What we're going to do today is talk with you about one of the surgical options called the gastric exclusion. So if you've been watching the video series, you may have heard about some of the other operations that we do, the fundoplication, the TIF, the links, different surgeries that are available. Part of the comprehensive reflux evaluation is looking at all your information and deciding what operation is going to work best for you. And this is one of the surgeries that people often end up choosing along with their surgeon, depending upon some of the factors that come up in their workup. We discovered that this is a good reflux operation a little bit by accident because we are also a bariatric or weight loss center. And so we do a lot of gastric exclusions. Of course, in that setting, we call that a gastric bypass. And that's one of the operations that's done for weight loss. But what we discovered over the years is that oftentimes as we were seeing people in the clinic in follow-up after their weight loss surgery, we realized in discussing things with them that we were curing a lot of reflux along the way. Also, as we'd done operations such as fundoplication, the Nissen or the toupee, and people needing revisions, sometimes the revision ultimately ended up as a gastric bypass as a therapy. And so we started using it as a revision operation as well. This has become more of a standard operation now for people who have an elevated BMI. And what we learned over the years also is that some people are not a good candidate for a TIF or a fundoplication or a LINX because of their BMI. Typically a cutoff for that is a BMI more than 30, but it typically also depends a little bit on your body distribution. People that have a BMI more than 35 are really not very good candidates for fundoplication or LINX because of the increased abdominal pressure on their abdomen, pushing that hernia repair, causing stress on that or causing stress on the fundoplication and contributing to increased reflux. So the Roux-en-Y gastric bypass or the gastric exclusion ends up being a therapy for that. So with the gastric exclusion, what we're really doing is disconnecting the source of the acid from the esophagus. When we do a gastric bypass, the first part of the gastric bypass is dividing the stomach into an upper pouch, which ends up being about the size of a golf ball, and then the lower part of your stomach, which of course excludes 90+% of the acid, and that acid ends up going downstream through the small intestine instead of going up into the esophagus. Of course, we can't just leave a blind pouch near the esophagus, so we bring up a loop of small bowel, and that loop of small bowel is called a roux limb, based on the surgeon that first described it. And once we connect that, then we reconnect the small intestine a little bit lower, and that's what creates that Y configuration. That's why it's named the Roux-en-Y gastric bypass. But what that does is it shifts all the acid downstream, and that acid then isn't in contact with your esophagus, and thus it's an excellent operation for people that have gastroesophageal reflux disease and also have a high BMI, or it also ends up being a revisional type operation for people that have several failed primary operations. The nice thing about this is oftentimes people that have an elevated BMI also have numerous medical comorbidities, and comorbidities are disease processes that go along with being overweight, such as type 2 diabetes, high cholesterol, and hypertension. So sometimes it's the best solution for people that have elevated BMI and multiple comorbidities along with gastroesophageal reflux disease. So this is part of why we go through this comprehensive reflux evaluation, because everybody's a little bit different, and what we're trying to do is tailor the operation to what is best for you overall. Some of the challenges or things that we have to think about after this surgery are vitamin and mineral supplementation. There's some education that goes along with it because obviously you have to eat a little bit differently, and so we go through that educational process as well. Thank you for watching. I hope you found this information helpful.